Hello, welcome to 101nursing.com. Today we'll be talking about acute renal injury, but specifically our prerenal injury. Prerenal meaning before the kidneys, before the renal system. And as you guys can see in this really awesome picture, it shows that prerenal is before the kidney. So the vessels that are bringing supplies into the kidneys. Um, yeah. So, what are the causes of pre-renal obstructions? Major is hypovolemia or hypertension. Hypovolemia caused by dehydration, hemorrhage, fluid loss via the GI system if you're having diarrhea, vomiting, gastric suctioning, ascites, burns, severe burns, fluid loss due to third spacing. Excessive diuresing by using laxative can cause pre-renal failure. As you guys can see here, ischemia that can be caused by dramatic cardiac output from your myocardial infarction or chronic heart failure. Dysrhythmias can cause decreased supply or ischemia to that region. Vasodilation caused by septic shock. Septic shock is very crazy because it's not that you're hypovolemic, it's that you're not vasodilating, so there's not enough fluid to fill the vasculature, and that fluid cannot be filled unless you vasoconstrict. That's why our body vasoconstricts and vasodilate in certain areas, in certain circumstances. Anaphylaxis can be caused by prerenal, can cause prerenal failure. Neurologic injuries, renal vasculature problems. So actual obstruction of your renal arteries, bilateral renal thrombosis, and emboli within your renal can cause issues. So, how do we treat prerenal issues? How do we treat them? You maintain effective intravascular volume. So you don't want to be ischemic. You're gonna monitor the cardiac index, cardiac output. What else? You're gonna make sure that all your bases are covered in this area. Restore blood flow if that's the case. Maintain cardiac output using inotropic support. Avoid vasoconstriction or decrease blood flow to the kidneys if possible. Hemodynamic monitoring, such like I said before, cardiac index and your wedge pressures. Your wedge pressure is usually going to be monitored in your ICU setting or your OR setting. And you treat the specific cause. If someone's an anaphylactic, you're going to give them their EpiPen or whatever's going on with them. If they're an MI, we're going to correct the MI, or dysrhythmia, correct the dysrhythmia to reverse your acute renal failure. And that is all. Thank you very much for listening. Have a great day.